Hi everybody, this video of mine is about lichen planus, which is a condition that can cause swelling and irritation in the skin, hair, nails and mucous membranes. On the skin, lichen planus usually appears as purplish, itchy, flat bumps that develop over several weeks. In the mouth, genital region and other areas covered by a mucous membrane, lichen planus forms lacy white patches, sometimes with painful sores. Most people can manage typical mild cases of lichen planus at home without medical care. If the condition causes pain or significant itching, you may need prescription drugs. Lichen planus is not contagious. Now let me tell you some of the symptoms of lichen planus. The signs and symptoms of lichen planus vary depending on the areas affected. Typical signs and symptoms are: Number 1 is purplish flat bumps, most often on the inner forearm, wrist or ankle and sometimes the genitals. Secondly, there is the itching. Third, there is a formation of blisters that break to form scabs or crust. Lacy white patches in the mouth or on the lips or tongue. Painful sores in the mouth or genital region. Hair loss, change in scalp color, nail damage or loss. You should see your doctor if tiny bumps or a rash-like condition appears on your skin for no apparent reason, such as a known allergic reaction or contact with poison ivy. Also, you should see your doctor if you experience any signs or symptoms associated with lichen planus of the mouth, genitals, scalp or nails. It is best to get a prompt and accurate diagnosis because a number of skin and mucosal conditions can cause lesions and discomfort. Now let me tell you some of the causes of lichen planus. This occurs when your immune system attacks cells of the skin or mucous membrane. It is not clear why this abnormal immune response happens. This condition is not contagious. Lichen planus can be triggered by hepatitis C infection, flu vaccine, certain pigments, chemicals and metals, pain relievers such as ibuprofen and naproxen, certain medication for heart disease, high blood pressure or arthritis. Now some of the risk factors I should tell you. Anyone can develop lichen planus, but the condition most often affects middle-aged adults. Oral lichen planus most often affects middle-aged women. Coming to the complication, lichen planus can be difficult to manage on the vulva and in the genital region, cause severe pain and sometimes it leaves scars. Sexual dysfunction can become a long-term complication. Oral sores may affect your ability to eat. The affected skin might stay slightly darker even after the rash clears up, especially in dark-skinned people. Oral lichen planus increases the risk of oral cancer. Left untreated, if it is not treated, lichen planus of the ear canal may lead to hearing loss. Now let me tell you how we diagnose lichen planus. If you come to see your doctor, he or she will make a diagnosis of lichen planus based on your symptoms, your medical history, a physical examination and if necessary, the results of the lab test. These tests may include biopsy. Sometimes your doctor may remove a small piece of affected tissue for examination under a microscope. The tissue is analyzed to determine whether it has the cell patterns which are characteristic of lichen planus. Also, he may order hepatitis C test. You may have your blood drawn to test for hepatitis C, which is a possible triggering factor for lichen planus. Some allergy tests can be advised, as a doctor may refer you to an allergy specialist, allergist or dermatologist to find out if you are allergic to something that can trigger lichen planus. Other tests may be needed if your doctor suspects you have any of the several variations of lichen planus, such as the type that affects the esophagus, genitals, ears or mouth. Now let me tell you the treatment of the lichen planus. Lichen planus on the skin often clears up on its own in months to years. If the disease affects your mucous membrane, it tends to be more resistant to treatment and prone to recur. Whatever treatment you use, you will need to visit your doctor for follow-up appointments about once a year. Medication and other treatments might help relieve itching, ease pain, and promote healing. Therapy can be challenging. You should talk with your doctor to weigh the potential benefits against possible side effects of treatment. Now coming to the drugs. First of all, I'll tell you about corticosteroids. This is the first choice for treatment of lichen planus and is usually a prescription corticosteroid cream or ointment. If that doesn't help and your condition is severe or widespread, your doctor might suggest a corticosteroid pill or injection. Common side effects of topical corticosteroids include skin irritation or thinning where the cream is applied and oral thrush. Corticosteroids are considered safe when taken as directed and for short-term use. Then sometimes we use oral anti-infection drugs. These oral medications used in selected situations for this condition are the anti-malaria drugs such as hydrochloroquine and the antibiotic metronidazole, which comes in the name of flagell. Also, we can use some immune response medicine. Severe signs and symptoms may require prescription medication that suppress or modify your body's immune response, such as azathioprine, mycophenolate, and cyclosporin. Also, we may advise use another drug that is known as methotrexate. Thirdly, we may prescribe you antihistamine. This antihistamine medication taken by mouth might relieve the itching of lichen planus. Fourth option of treatment is light therapy. This phototherapy may help clear up lichen planus affecting the skin. The most common phototherapy for lichen planus uses ultraviolet UVB light, which penetrates only the upper layer of the skin, that is known as epidermis. Light therapy usually requires 2 to 3 treatments a week for several weeks. This therapy is not recommended for dark-skinned people who have an increased risk of their skin staying slightly darker even after the rashes clear up. The fifth mode of treatment is retinoids. If your condition does not respond to corticosteroid or light therapy, your doctor might prescribe a retinoid medication taken by mouth, such as acitretin. Retinoid can cause birth defects, so these drugs are not recommended for women who are pregnant or may become pregnant. If you are pregnant or nursing, your doctor may opt to delay topical retinoid therapy or choose a different treatment. Then we must deal with the triggering factors. If your doctor suspects that your lichen planus is related to hepatitis C infection, allergies, or a drug you take, you might need other treatment. For example, you may need to switch medication or avoid offending allergens. Your doctor may refer you to an allergist or, in the case of hepatitis C infection, a specialist in liver disease hepatologist for further treatment. Now let me tell you some of the lifestyle changes and home remedies about lichen planus. These self-care measures can help reduce the itching and discomfort caused by lichen planus. These include soaking in a bathtub with colloidal oatmeal such as avino and others, followed by a moisturizing lotion. You can apply cool compresses using an over-the-counter hydrocortisone cream or ointment containing at least 1% hydrocortisone if you are not using a prescription topical corticosteroid. Then you should avoid scratching or injuring your skin. For oral lichen planus, good oral hygiene and regular dentist visits are important. You can help reduce the pain of mouth sores by avoiding smoking, drinking alcohol, consuming spicy or acidic food and drink. You should avoid these things. There are some other options in alternative medicine. A couple of small clinical trials have suggested the benefit of aloe vera gel for treating lichen planus of the mouth and vulva. You should look into alternative medicine approaches that help you reduce stress, as stress can worsen the signs and symptoms of lichen planus. You should talk with your doctor before trying an alternative treatment for lichen planus. Because some alternative medicine or vitamin supplement results in serious adverse reaction when combined with prescription medicine. I hope you like this very informative video about lichen planus. If you have lichen planus, or if you want to discuss about some other illnesses, you can write in the comment section of this video, and I will try to answer you as soon as possible. And if till now you have not subscribed to the channel, please subscribe it and click the bell icon and select all options, so that all upcoming videos should be delivered to your inbox straight away. Okay, and if you think that there is a little bit benefit of my videos, even 5-10%, if it is my videos are helpful to you, please like the video and share these videos with others through social media such as Facebook, Twitter or WhatsApp. Thank you very much for watching this video. See you in the next video.